In this video, I'm going to give you some facts about why there is a difference in price between the most expensive and the cheapest advertised dermal fillers treatment, so that you can understand what you might or might not be getting for your money. Hi, this is Anna and I'm the clinical director and founder of Anna Medical Aesthetics. When the first dermal filler was launched in the UK in 1988, the average price for 1 ml syringe was about £300. Back then, all cosmetic injectable treatments were performed by the medically qualified practitioners only. Today, the average price for one syringe is not dissimilar, even though we have experienced well over 100% inflation in price of most services over that period, which would mean that the price should be about £600 today. The reason that the average price hasn't changed from £300 is probably because of price pressure from non-medically qualified people such as hairdressers or beauty therapists who have started to use dermal fillers due to the lack of effective regulations of the cosmetic injectable marketplace. They have generally competed on prices to undercut the medical professionals, but this can come with some hidden compromises that many people do not fully understand. Firstly, there are now literally hundreds of different dermal fillers brands available, although most clinics in the UK only use a handful of brands supported by the world's top dermal filler producers. The cheaper the price of the filler, the more likely is that you will be getting a filler that has little or no clinical evidence or training supporting its use. Or even worse, that it could be a cheap copy that someone bought from abroad. This could have long-term implications for safety and possibly invalidate any indemnity insurance that the injecting practitioner has. There are also some practitioners offering cheap fillers who cut corners by using the leftover products from previous patients where they haven't needed to use all of the syringe. This is potentially dangerous from a cross-infection perspective, so always make sure that you see the practitioner unwrap a new box in front of you. The very best clinics have also invested in expensive ultrasound technology that helps them to visualize nerves, muscles, and blood vessels beneath the skin when injecting, which reduces the risk of side effects and complications and help them to place the filler more accurately. Expert practitioners who are specialists in the use of dermal fillers have been trained to achieve natural-looking results, which is more important than the price you pay per syringe, as in some aesthetic clinics. This means that the cheapest price per syringe could be a false economy when it comes to achieving beautiful and natural-looking results using the holistic facial approach and not number of syringes. Getting true value with the dermal filler treatments is a balance between price and the results that you're looking to achieve and a reassurance about your safety. The more expensive clinics are often regulated by the Care Quality Commission. They have a full-time medically trained prescriber who specializes in the use of cosmetic injectables and has a wider skill set and specific training in achieving subtle, natural, long-term results. In addition, you have a safety net in that they are also specifically trained to deal with any complications of any treatment. Hopefully, this brief video will have given you some useful information about how much you should pay for dermal filler injections. If you're interested in having cosmetic injectable treatments and you would like a more comprehensive guide to choose the right practitioner for you, please just click at the link at the end of this video. The guide is free and no email or phone number is required, as it's been written to help you to avoid some of the common mistakes that people make when they're putting their trust in a provider of their Botox or dermal fillers injections.